Hi, Doc, and hi, other Doc.
Hi, Luke.
Right, thank you so much for joining Women and Men Against Child Abuse for the second part in our podcast. So, what actually sort of gave rise to this topic for us was that the Department of Social Development issued a memorandum essentially closing what are called the baby savers. So, the baby savers, for those who don't know, are holes in the wall that people can safely relinquish their children, and as a result those children are abandoned for care as opposed to abandoned for death. So I've got the two doctors with me, and just to explain, Dr. Efrat Barnes, she is the head of the Child Abuse Clinic for the Pediatric Academic Circuit as well as the Charlotte Maxeke Hospital, and we have got Shirley, who is a forensic pathologist, used to be with us in Hillbrow, but is now, I'm told, in Pretoria. But we're going to talk about her work in Joburg. So the reason I've got these two doctors with me is that the other side of the story is not being told. And that's the side of the story where social development will say, we're closing these baby savers because there's trafficking. Does trafficking of children happen? Sure. They're also saying that there are too many statistics and too few children. In other words, they're claiming there's like 3,500 children who are being abandoned, but we're not seeing 3,500 children go through the courts. That's a real concern, okay? However, here's what we're here to talk about. When we go from pediatrics to pathology, we are going from children who have been hurt to children who get killed. And that's the story nobody's telling, because it is just too dreadful that we have these children in the city whose births are not celebrated and their deaths are not mourned. And there can be nothing more tragic than that. So we're going to start with you, Efrat, because we currently have a case in court. So this mythical idea that, you know, parents are always good things and we have to have family preservation, and the fact that, you know, under all circumstances we need to reunify families is quite mythical at times, because there are parents who actively torture their children to death over a period of time. So would you mind just taking us through a case where, and I think the most recent one would probably be the best, of how that child arrived at you, what you saw that parents did to their child?
So yes, indeed, I agree with you. I think that there is a myth out there that parents will go out of their ways, bend over backwards, would kill and die for their kids. And then you come across the other extreme where we had this little boy brought in by the stepmother. Dad was nowhere to be found. We were told repeatedly that Dad was traveling in Cape Town. I was sent photos already the evening that he was admitted. The following morning, I joined the ward round early in order to hear what ICU had to say. Unfortunately, we do have a restriction of beds, and this was not a child that we could admit into ICU, and that was because of his growth. So something that is just an indicator of the chronicity of the abuse. This was a child that was, very simply put, tortured, and that, I think, is what I said in court to the judge. This was a child that was repeatedly tortured, and then again we still continued to phone the dad, speaking to him in his vernacular to make sure that he understood the seriousness of the case and that the child was not going to make it. We'd set up a little ICU for him in our casualty. The child eventually demised at about 12 o'clock in the afternoon, and I was still with the police waiting to make sure that the forensic department safely gets the body. We were flagging it, and then the dad walks in and says to us, no, he had been in Springs. So, but you'd been told, you'd been phoned so many times. One of the questions that his defense lawyer asked me was, did you believe the father? And the fact is that our job is not to suspect everyone that we meet. We want to believe that people are good in their essence. It's only when we sit down and we look at all the facts that we say, oh, this is not adding up.
Now, if you can just explain, because I was in court when you gave evidence, so can you just explain what you saw? Because I think people don't understand what happens here, because there was two things in your case. The first was an active commission, so in other words, this child was actively harmed, and then there was an active omission. The child was basically starved to death. And it was so drastic that the child's body just gave up eventually. So there was no single cause, which was another issue with the defense and what's the single cause, which we'll get to with the pathologists. But the thing was, it was death by installments.
Definitely, and essentially they just kept throwing whatever they could at this child. It was like a boxing bag, and eventually he had no reserve. So it wasn't only the fact that he had been starved, especially when you look at the parents, both the stepmother and the father, very well fed, healthy looking, and then you've got this child with failure to thrive, wasting. And what was most dramatic was the injuries on his body. So he had multiple burn marks where he'd obviously been burnt with instruments. And I think the most significant was what we found on his back. And that was a child that had obviously been dragged on a really rough surface. And when I first saw him, again, I'm an optimist, so I want to believe people are good. And I said to the stepmother, don't be scared. Was he knocked over by a car? Just tell me the truth. You're not going to get into trouble. The answer was no. This was a child that was systematically, slowly killed, tortured and killed.
Now, Shirley, I want to come to you at this point because I was very lucky to be invited to your in-service lecture, and I think your experience is critical for people to understand this link between abandonment for care and abandonment for death. So in your experience around children who are being found, so these are children now who have literally been thrown away. What are you seeing at forensic, in your Hillbrow experience, what are you seeing in forensic pathology?
Well, our numbers of abandoned babies, and these I'm talking about from conception to infancy, have increased in the last number of years. We're seeing that what we see in the Hillbrow experience correlates with this, and we're wondering why. And I think there's a lot of underlying factors that we're not going into. We going onto the superficial surface of it. These cases don't get prosecuted. They are deprioritized when it comes to our autopsy slate because we want to catch the murderer, and already these cases are difficult because you can't find the parents, so they get deprioritized, and it decreases the quality of autopsy. And we need to look into the underlying factors. Who are the parents of these children? Are the so-called parents children themselves? The laws that we have governing just adult activity, let me call it that, in South Africa, the fact that a 12-year-old legally is able to engage without any legal consequences. Who are these people engaging, these children engaging with? And they're not even old enough to be mature physically, let alone be parents.
Absolutely.
And these are contributing to our, I believe they contribute. We haven't proven it.
Sure.
But there are media reports out there that have quoted young mothers that have gone for counseling that are known to have been raped by known people, neighbors, so-called family members. And they definitely do not want these children, and we can't blame them. So we need to go deeper into our society, which has actually gone into a downward spiral. We've got some of the best laws in the world. Our abortion laws have been also quoted as being the most liberal, in that children can approach a health service for termination of pregnancy. But there are other factors that come into that as well. It's obviously a disgrace in most communities to be engaging in premarital sex as a child. So there's that stigma attached. How the hell do you expect a 12-year-old to walk into a clinic, first of all, for contraception, never mind a termination of pregnancy?
Absolutely.
So these are all underlying factors that I don't think we are paying enough attention on. I think our family structure in South Africa also needs attention. Our family structure that is where justice and discipline starts. It's in the home, and I don't think we have enough of that. I think because of the abusive parents that we have, our innocent parents are now restricted from disciplining their children. We have too many fatherless, so-called fatherless homes in South Africa, where the father figure who metes out the discipline, just with that positive masculinity, is absent from our average home. 80%, as far as I know, of the last statistics I was told, of homes in South Africa, black children grow up without their fathers. This is alarming.
It is. And Doc, if you could break down your autopsies into, I mean, as you say, they're not prioritized, but my understanding is there's three, from your talk, there's three broad categories.
Yes.
So there's the pre-26 weeks, which is that sort of rump and crown measurement. And then you've got the post-26 weeks, but sort of pre-40 weeks. And then you've got the post-40 weeks. What are you seeing in each of those categories?
Okay, so the reason why those categories are important is because of the Criminal Procedure Act, which governs the issue of abandonment or illegal abortion, for instance. So at the age of gestational age of 26 weeks is when a fetus is considered viable, a legal entity. So before 26 weeks, although after 12 weeks, it's considered an illegal abortion unless there's a medical reason for that abortion to occur.
That's in the Choice of Termination of Pregnancy
Act.
Okay,
Yes.
Got you.
But so it's an illegal abortion, but the Criminal Procedure Act only comes into play after 26 weeks when your conceptus or fetus is a legal entity. And then it is considered a murder as per our laws. We don't, like some other countries, have different laws for infanticide, for instance. In South Africa, it falls under the common law term of murder. Yes.
Got you.
And so the illegal abortions have caught my eye. The numbers are definitely going up. The issue is as well, once they're abandoned after the age of 26 weeks, was it a live birth? Was it a stillbirth? This is one of the key issues we have to establish at autopsy. And now that makes it difficult as well, because already these cases, they're discovered late. Already you've got a level of decomposition. And then they're being deprioritized in the forensic setting. You've got further decomposition. So you've got gases building up in the body. You can't differentiate whether those are gases that the baby had breathed or not, or whether the bacteria, due to the decomposition, have created those gases. So that's where we need to be prioritizing these cases. But the other side of the coin is police can't find the suspects. And like I've said, the so-called suspect, which is considered to be the mother, what are the underlying circumstances? Was she raped? Was there incest? Is she an underage mother? Is this an unwanted teenage pregnancies? And on that other note, we need men to start taking responsibility for their reproductive health.
100%.
How many of these are the product of statutory rapes? Men need to start taking responsibility and admitting that these are their unborn children as well. And they need to take responsibility for that when engaging in adult activity. And I'm hoping that this message will get out to at least a number of people, and that we start somewhere, because I truly believe that we're not getting to the bottom of these problems. This is why our police are frustrated. This is why our pathologists, our doctors are frustrated, because it's just spiraled completely out of control. Our thread of our society is actually broken, and it needs to be put back together.
And then my last question for you now is that I'm also told that some of the post-40 week children have actually, when you do the autopsies, they've actually been murdered.
Yes.
So that they haven't just been discarded like a a late
Yes.
termination. They've
Yes.
actually been actively killed.
All right. So some studies have shown that the most common cause of death in these children is strangulation,
Okay, sure.
or smothering
Sure.
is the second most common. They have also been found to have been stabbed in certain instances.
Sure.
And there are also, it's been reported that you get two sort of profiles with these mothers. Infanticide, by the way, is most commonly reportedly committed by the biological mother.
Sure.
And it's divided into neonaticide, which is within the first 24 hours of birth,
Okay.
and infanticide, which is up to a year of age. And your neonaticides are your younger mother, your teenage pregnancy,
Okay.
your unwanted pregnancy. These mothers don't usually have any diagnosis of any psychiatric condition, whereas with your infanticide, it's an older mother, possibly the mother of other children, possibly with postpartum depression,
Okay.
possibly with schizophrenia, also sometimes unproven.
Right.
So these are the two categories that we're looking at theoretically. But like I said, I've hardly seen any prosecutions
Of any
in
of
these
those.
cases.
Really, yeah.
Yes,
Sure.
hardly.
Sure.
I've had one investigating officer regarding abandonment, which was I think it was a 26-week gestation fetus. It was a witnessed abandonment, and again the decomposition was so severe in this case that I could not prove whether
That
this
they'd taken a
deceased,
breath.
yes, was live born or not.
Sure.
So this was a real problem.
So, Doc, let's go back to you. Now, I think what Shirley has raised is very important, because you run the sexual abuse clinic at the Joburg Hospital. What are you seeing as the trends in terms of these young people coming in that have been sexually abused? What kind of abuse is it? Who are the accused? What are the outcomes in the cases?
So it's interesting that you actually talk about this, because we've got a current case at the moment, and I believe she actually delivered yesterday. 12-year-old child, a mother has gone on some sort of religious ritual. The mother's father, so the maternal grandfather, refused to contact the mother. The child that we're talking about, the index patient, had been raped by her stepbrother, and the father decided that she may not abort the child and insisted that she give birth. And again, it takes us back, and we're talking about gender-based violence. We're going back to that patriarchal society that they will decide for us what happens with our bodies, whether they be children or women. And unfortunately, with a lot of the girls that we do see, I must, however, emphasize that boys and girls in South Africa are equally vulnerable to abuse. But with a lot of the girls, these are people that they know, they trust, people that have been in their lives. Most of the time it's unrelated, but I think that is obviously what is creating that second barrier to the child coming and actually making that disclosure to us and telling us that this is somebody that I love, this is what they're doing to me. And I think it was a couple of years ago you posted something where it said children that are abused don't stop loving their parents. If they are abused by their parents, they stop loving themselves.
Now, what are you seeing in terms of, so what Shirley's telling us is that the criminal justice system is wholly inadequate in dealing with your cases. We get no prosecutions,
We're completely overwhelmed.
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 Okay.
There's just so many other murders where the suspects are known, and this is overwhelming our police. I mean, each of our detectives that I know sit with at least 100 to 150 dockets.
Sure.
This is
Crazy.
This is beyond manageable.
Sure.
It's beyond manageable, and the mental state.
Just that when you need the mic because we're recording, the
So
talking stick.
I heard another statistic that was a bit higher, that each investigating officer sits with about 300 dockets, and that the rate of successful prosecution is less than 1%.
What is your experience? Because we're hearing, and I think for forensic pathology and these inquest dockets, it seems to be a case of priority. Whereas what you work with is you work with a specialist unit, so which is the family, child and section, which they don't have. So I think that's the other proviso. So what are you seeing in terms of your cases in the criminal justice system?
Unfortunately, I would love to say that working with the family and child unit makes a difference. The FCS, you still need to escalate things and escalate to colonels and people that you know in order to get the attention that we need. So that is still an ongoing challenge for us. Sorry, your second question was?
No, it was just the outcomes. So Shirley's saying she's like had one. What are you seeing in terms of outcomes?
I had a most remarkable outcome this year for a case that I saw. It was a 11-year-old that I saw in 2018, and because of COVID, nothing happened. And then I was eventually asked to come and testify in 2021. And we got judgment in March this year that he was found guilty of rape and 25 years, which was so empowering for us, because it means that we are winning. It takes time, but we are making a difference, and you just need to persevere. But I think one of the other things is that you can't work in a silo. So I was actually speaking to Shirley earlier and telling her about a case that I had with one of our colleagues. And the only reason we were able to put it together was because we knew who to speak to. So we had taken pictures of a child that was admitted. We knew there was another child that was potentially murdered. The parents, the family was not willing to disclose anything. And we sent those images to the forensic pathologist and asked them to please look for a child with the same injuries, because the perpetrator will have the same pattern of injuries, and they were able to identify that child.
That's amazing.
So it's like a puzzle, and it's about perseverance and not giving up, because you will eventually put all those pieces of the puzzle together.
Okay, so thanks. It's nice to end on something where the system works. So, go.
I think the frustration we having is with the illegal abortions and the neonaticides, but with the older children that you're speaking about, we have had some prosecutions.
Okay.
I've had the most recent was a 5-year-old girl, unfortunately beaten to death, allegedly by her father. But one thing that stuck in my mind is that when his girlfriend actually asked him why he was doing this, his answer was, because I was beaten.
Sure.
So we're also dealing with intergenerational trauma that has not been dealt with. Not that it excuses what's going on, but it needs to be dealt with as well.
Otherwise it's repeated, as you said.
Yes, absolutely.
Doc, you worked at one stage pre-COVID in a pediatric obs and gynae casualty. So you are seeing these cases that actually come to the hospital that Shirley is seeing dumped in the street. What were you seeing in casualty?
Just the most horrific scenarios, incomplete abortions. We even had a case of a mother, I think it was last year, that she had crossed the border, delivered, she had managed to hide her pregnancy, and I think the baby was a couple of hours old, and she threw it out the window. And the child eventually ended up at our ICU at Charlotte Makeke. But unfortunately, the incomplete abortions where the mothers come in unbooked, the child is in a dire state, and you now have to try and resuscitate this child that is clearly not wanted.
So you've given two. Just let's finish with you, Efrat. You've given two scenarios. One is the incomplete abortions, and then there's the inflicted injuries. So these are the injuries thrown out of windows. What are you seeing in terms of the abuse of head traumas?
Unfortunately, we're still not seeing enough, and the reason for that is simply because doctors are not looking for it.
So they missed diagnostically.
They are being missed. Okay. And I think that is, if you look at the statistics worldwide, they'll say to you that a lot of these statistics are probably inaccurate because we're missing a lot of them. A lot of these kids will die. I know of cases of children that died during COVID where doctors were scared to touch them, and unnatural deaths were actually signed off as a natural death. So yes, we are picking them up. As I said, I do assist the pediatricians in private, and I do get calls from all over, and it's wonderful to see that there are more doctors that are willing to get involved and stick their necks out. It's more of the younger doctors. Yeah. I had a case about 2 years ago where the child was found with posterior rib fractures, typical shaking, and the senior radiologist refused to report it. Sure. And it was the young junior radiologist that came in the following morning and said, no, I am reporting this. And it did eventually go to court. So this was a case in private.
So you've seen the same kind of things, Doc, but you've seen the other end. So tell us what you've seen in terms of the incomplete terminations and then the head traumas.
So this is the other facet of these abandoned fetuses, is how many of those mothers are maternal deaths that are possibly not coming to us, because a maternal death is not necessarily deemed an unnatural death, depending on the cause. Okay. So the septic abortion that she mentioned, I know of a 16-year-old total hysterectomy because of septic abortion. Okay, so these are the other complications that are another facet of these unwanted pregnancies and illegal abortions that are not being linked either. One of the other issues that is brought up in the medical literature is the argument for laws that are open to termination of pregnancy in order to decrease maternal deaths. Sure. Because you are unfortunately going to get backstreet abortions increasing where your laws are not providing such, and this is an increase in the maternal death rate.
So it's almost a gendered violence all the way down. Absolutely. Where you've got this gendering of the fact that men don't take responsibility for their reproduction, they abandon the woman ends up in a position where she's desperate, and then not only potentially kills the child, but also potentially dies herself.
We've also got the other scenario where how many men actually know that they've actually even conceived a 100%. Child? Yeah. This is why I'm saying, this is why I'm so strong about men need to take responsibility.
I hear you.
When I spent a couple of years in anatomical pathology where we deal with natural disease and other natural issues, every single day, a couple of our routine cases were fallopian tube ligation specimens from women. But I think in my 8 years in anatomical pathology, I only probably saw 2, maybe 3 vasectomy specimens. Sure. That says something.
Crazy.
That says something.
Yeah, that says a lot.
Men are not taking responsibility for their reproductive health, and it needs to begin.
To change.
It needs to change.
Okay. So my final thought for this is based on the fact that, Efrat and I have done developmental courses together, so our other job is the development of children, and I've studied with you because I'm doing my MSc research with your unit. So I want to tie it up with the thought, Ivan, then your final thoughts. For me, there's been a complete and utter failure of our family planning system. And option counselling and all the other things. Even the laws and the services that exist, we find these babies in Hillbrow next to clinics. It's not like these people don't have access to services.
So from what I picked up is apparently only 5% of our government healthcare facilities actually offer the termination of pregnancy
Oh, really?
service.
Okay, that I didn't know.
That was from a media report.
Really?
Yeah.
Okay, that's interesting.
And this is an issue, and also, like I mentioned earlier, the stigma attached to a young teenage mother going to ask for a termination of pregnancy. I think this has created a market for the so-called backstreet abortionist, where with the passing of the Termination of Pregnancy Act in 1996 came the use of misoprostol, which was actually a drug originally meant for
gastric issues.
And it's now, because it's a prostaglandin analog, used for termination of pregnancy. This drug is on the black market everywhere you go. It's being advertised on lampposts, the side of bins, etc., in the form of a telephone number and the word abortion. And these are the black market dealers in misoprostol. And it's the privacy, the lack of questions, the lack of record is what is pushing our young mothers to the backstreet abortionists.
And it's the same lamppost that are advertising to make your member larger with
Absolutely.
other. So there's this weird juxtaposition
Exactly.
of those two things.
Which is why I say men need to take responsibility as well.
Okay, so that's where I want you to give us your concluding thoughts. So what I'm trying to think about is a concept around pre-conception attachment. So in other words, it's planned wanted children to be fancy, so I'm just going, but that we need to teach young people to conceive a child in mind first,
Right.
before they conceive a child in body. Because all of these other services, the stigma even, as you said earlier, for getting contraception to prevent this is maybe not as bad as the termination, but it's still
bad.
It's still bad,
Yeah.
And I think we're a very religious country, and I think what has happened is people take their personal things like their religious beliefs, like nurses, and say, you're not allowed to do this, this is sinful or whatever. So give us your final sort of sum up big picture thoughts, the dream of how we can, and then I'm going to ask you the same question.
My dream is that the family unit needs to be rebuilt in this country. The basic family unit, mother, father, child. Child born out of love within marriage needs to come back.
Okay.
That is my dream that will, I believe, diminish a lot of the problems that we see. And there's a lot of work to be done. We have some of the best laws in the world, but we're not able to apply them properly because our basic common law is not in order.
Lovely, thank you. Doc?
I do have to add one big thing because I work in the Gauteng area. For us, our biggest challenge is dealing with foreign patients. So we have these very porous borders, and unfortunately we don't have the facilities to deal with these extra foreigners' children. So I see children that are severely autistic that need to go to special schools and cannot apply because there's no documentation. I think for me, I agree with what you've said, but additionally, I think let children be children. All children's lives matter, and we should really just fight whether they are foreign or not. Whether a foreign woman comes and is requesting a termination of pregnancy, we should uphold the Hippocratic oath and what we promise to do. I think that's very important.
Absolutely.
And not to judge.
Correct.
Any final thoughts?
Take care of yourself. Take care of yourself. Listen to your parents. Listen to your grandparents. They know a lot.
Absolutely.
I don't know how we're going to deal with the intergenerational trauma.
Yeah.
Talk about your problems. Don't be silent. Find someone to talk to. Find someone professional. Maybe you can't trust anyone, but keep talking. I think drop the stigma about everything.
Absolutely.
One day, at some point, you will find someone who cares and someone who listens and someone who can do something about it so that we get out of this spiral.
Okay, so I think Shirley left us with the challenge as adults, and particularly professional adults, but I think all adults, that we need to be the illuminated witnesses to children's lives. We need to be there to rejoice in their birth. We need to be there to rejoice in their brisses and their bar mitzvahs and their christenings and their baptisms and confirmations and going to the mountain as it calls a man to become a man. And we need to encourage those rights. And I think what Shirley's saying as well is that there's nothing wrong with tradition. There's almost been a bit of an attack on tradition where we're saying that, the tradition doesn't always work. Well, there might be negative things to it, but I think the love of a family is a tradition that we should uphold very strongly and not sort of cast everything out in terms of what is traditional is vested with some kind of potential negativity. So thank you very much for joining us on episode 2. Women and Men Against Child Abuse will be picking up some of what Shirley has asked us to do, which is asking men to take care of their own reproductive health and thinking about men and sexuality and masculinity in our next podcast. And we will be hosting Zama, who is with Panda, and he's a psychologist, and it will be him and me as two men discussing how we can raise boys to be good, healthy men. So thank you for joining us. Thank you, the two of you, for joining us.
Thank you so much for having us, Luke.
It's been an absolute pleasure and enlightening from both of you. So see you in episode 3.